With the upcome of immune checkpoint inhibitors, also novel therapies like CAR T cells, it got quite disappointing in clinical trials with CLL patients that these agents are not very effective in this disease. So what we believe is now that timing is essential, right? Because we know that CLL negatively impacts on the immune compartment, specifically on the T cells. So if we are performing CAR T cell therapies or immune checkpoint therapies at a stage where the immune compartment is very defective, very dysfunctional, so this might explain the lack of success. So we are proposing now that we really have to sequence therapies in a, let's say, rational way, also trying combinations, so debulking the tumor first and then coming in with immunotherapy approaches in a way that the T cells can also get activated against CLL and against the tumor development.